Speaking of things that do help in terms of research and making sure that we're making strides, our guest for this hour is already seated, Dr. Eva Aluvalaa, right?
Yes.
A lot of V's and L's in there, but we'll try to keep it. Is our guest this hour. She's the head of human DNA and forensic lab at KEMRI. Many words that already need definitions, but that's why you're here this morning, to be able to walk us through some of these things. So we're going to say thank you and welcome to Kenya's biggest conversation. You're in the hot seat of the Situation Room this morning, and even as we look today at DNA testing, we've heard it, we've seen it practiced. We've got a big area in Kenya at the moment whereby DNA testing has been looked at for the last 2 years, but we'll look into some of those details as we get into it. So thank you for being here this morning, and karibu sana.
And thank you for having me.
We welcome you in a different way to the Situation Room every day. CT Muga, who's not here today, has left us with a proverb to share with you. He goes to African countries every week, and every week he comes back with a basket of proverbs from one African country. This week we're in the country of Uganda, which, by the way, has the most lakes in Africa, closely followed by Kenya in second place. So the proverb for today, you tell us what you think about it after I let you know what that is and how you would interpret it. We give you work already, as though you don't have enough work to do at KEMRI. But we give you work to do already right off the bat. No matter how powerful you are, you can never make rain only fall over your house. Should I go again?
I think I got it. Yes, yeah.
What do you think about that, and how would you interpret it?
Even if you can, your influence or whatever you can do will not just affect you, but it will affect a population. Yes.
Wow. Yeah. It will affect everybody.
Yes.
Yeah. I like that. So in this case, you are the rain. In this case, you are the rain. Yeah. Great interpretation. Thank you for that this morning. So even as we get into things this morning, and we're looking at DNA testing, and when we just hear DNA testing, my mind just starts to go into very, very many layers. But let's just get into some of those definitions. First of all, what is DNA testing? Why is it important, Dr.
Okay, so DNA testing, DNA is basically your genetic makeup, what you inherited from your parents. And it can be used for identification purposes, and it can also affect your health. So if you inherit like a disease from your parents, it can affect you, and you can also transmit to your children. But the same DNA can be used for identification purposes, as may be in family relationship testing, or in cases of disaster victim identification or other forensic cases. And so it can be used to trace origin of and maybe help with treatment and management of particular diseases or conditions. Exactly.
But at the same time, it can be used to actually find who an individual is and then trace them back to their family and say, okay, maybe we have, in the case, unfortunately, of death.
Exactly. Yes.
It can also be used in terms of the law. When you're trying to now trace an individual or see maybe who may have
committed a crime. For example, a sexual assault case. Yes.
Okay, so we use it for health. At the same time, we use it for the law. It seems as though you're using it, across board. So what exactly do you do? What exactly do you pick up to then be able to trace? We can do that across the three areas that we've talked about. Number one, when you look at disease, and then when you look at, looking for an individual, and then when you talk about the law. What exactly do you pick up, and then how do you now match?
So DNA, we have two types of DNA. We have the genomic DNA, then you have the mitochondrial DNA. The genomic DNA is inherited 50-50. You get 50% of it from your father and 50% from your mother. But the mitochondrial DNA is exclusively inherited maternally, meaning that you can be able to trace your maternal lineage using the mitochondrial DNA. So when we have paternity disputes, what we would use is the nuclear DNA, and then you'd be trying to see the contribution that the mother has made and the contribution that the father has made the child, so that you can say that that child belongs to this man or not.
Okay.
But then for the mitochondrial DNA, we only use it in special cases, like missing person ID, for example, where bodies have been badly degraded, and possibly the immediate relatives are not available, for example, your parents. But because you can be able to trace your maternal lineage, anyone who came from the same maternal lineage, for example, it's your cousins, your uncles, as long as you have the same maternal lineage, can be used to as a reference point, so that you can be able to identify the missing person.
When we talk about the DNA testing in the country and the services that are offered, for a very long time, it is a conversation that is believed to be held in elitist environments. A lot of Kenyans do not understand what all this DNA is all about, So how do we communicate these to Kenyans so that they understand that it is something that they can take advantage of, because it is part of their livelihood anyway?
It is, I would say it is affordable. The service is available. It's just a walk-in, and we are able to take them through. And they should feel free to call us and maybe get more information about the test. Yes.
How do you make sure that that information gets to them?
We are available on our website. You can even chat with us on WhatsApp and even call us. Yes, or just walk in. We have someone who can take you through what is required and everything, any questions that you would want to ask about DNA testing. Yeah.
Okay, so when you do go into DNA testing, what are some of the risks that are involved in terms of making sure that you find what you're looking for? Is there any kind of risk that is posed to the individuals that you may be lifting DNA samples from? And what kind of samples are we talking about? Saliva, blood samples, what?
Okay, we can handle a whole scope of samples, from a saliva sample, a blood sample, any tissue in the body, including bones, nails, hair. It just depends on the situation. For example, if someone comes in for a paternity test, then we'd go for the easiest sample, which would be the saliva sample or a blood sample. But if it's a missing person ID, maybe a body in the morgue, we might not have the option of collecting a saliva sample or blood sample, so we might go for the harder tissues, the nails, the bones, depending on the state of the body.
Okay.
Yes.
I'm going to go to an issue, and I think going to a current issue in the country would now maybe give us a better understanding of a lot of the important work, for example, that KEMRI does when it comes to DNA testing. So 2 years ago now, we then were, invited into this craziness that happened in Shakahola, and bodies were found in the ground. They started to exhume them. The exhumation process, I believe we're in exhumation round 6 now. We've not heard a lot about that, but we can get controversial, but we won't. We're just now focusing on the DNA part. There have been body remains that have been kept in a certain place for lack of identification. That process or progress has not been made known to would-be families. It seems to be taking some time to be able to identify. Very few out of the hundreds have been identified. Why would it, in what circumstances would it take so long if you have a sample from remains? Because you've just told us you can do bone, you can do tissue, you can do blood, saliva. Why would it take so long to then be able to identify who these people were and match them to their probably waiting families?
I would say the issue is I could be able to generate the DNA profile from the victims, but are the references or the relative samples available? Because you can only identify if you're able to match.
Yes.
Okay.
Yes. So that might be one of the challenges.
So if I say that we're doing DNA testing, wouldn't that be one of the things that I would do if I have family members who have come and said, I'm looking for my person, and you know that we're going to employ DNA testing, wouldn't that be the first thing that you would do? Take samples from these families and have them on hold, and then if you get samples from the remains, you would then begin the process of matching. I mean, I'm saying it so simply, but I don't know that it's that simple.
Exactly, but you are assuming that the relatives who have come, their relatives are the deceased ones. It's an assumption. They're looking for their missing person. But they might not have necessarily been the Shakahola victims. So you could have done the profiles for the relatives. You try matching with the Shakahola victims' profiles, but they're not matching because those are not the right relatives.
So even if you have a sample on hold,
so you still need to get more and more references. Yes. And then another challenge might be the method that you're using for identification. For example, the Shakahola samples, you might need to employ methods like the mitochondrial DNA analysis.
What does that mean?
Now, maybe not all the deceased, the victims, have their immediate relatives available. So if you're using the nuclear DNA, which I told you is 50% from the father, 50% from the mother, if parents are not available, you're not going to get a match in terms of a paternity or a maternity test. So such victims, you might need to go and source for other relatives who are probably maternally related to the victim. So have they come forward or not? Do you have those relatives or not? Yes. But one of the things you could probably do, what we need as a country is to have a missing persons DNA database. So that in as much as you have not identified those people, the database still remains. And people can come forward even 2-3 years later, relatives, they're still looking for their people. And we can have this database in place, and you can still now profile these relatives and then now run against the established missing persons database.
You bring up the subject of a database and the need to have it. Does it mean that at the moment we don't have a database, or is it a question of policy or legal framework?
Yes, we do not have a database, including a criminal database. We do not have.
So that means with all the information that you have, it's something that you hold on to for a specific period of time?
Yes.
And you discard it?
Yes, and you cannot. And personally, in KEMRI, we cannot even use it because there's only legislation for dangerous crimes. Yes, for there to be a database. And the custodian is the DCI.
Okay.
So right now we're saying that if I were to go in, for example, because there's no legislation at the moment, if I go in and my samples are taken, you cannot store them for future reference for something else.
You cannot use it as to generate like an offender database or a criminal database because there's no legislation per se, apart from specific crime, which have been classified as a dangerous offender. Yes.
In what circumstances can you keep samples? I'm looking at something like, for example,
maybe if the case has not been, it's still in court. Yes.
But just now in this, clearly it's just legal that we're talking about. So if we're talking about other like medical, you cannot keep such samples for further reference.
Those ones
if
you
we're looking
can
at
do.
The science of it.
Like if you come to KEMRI, we have like our IRB, Institutional Review Board. So they can give you authorization to use those samples for research for a certain period of time. You can even get like broad consent from the participants for you to use their samples for other studies, genetic studies, yes. But not for investigative purposes. Yes.
So there is the subject of when you talk about the information that you have and the data that you also have, there is the subject of confidentiality of this information such that you cannot share it with authorities, or anyone cannot just walk in and demand to have all this information. So assuming Aseto, I have walked into KEMRI, I want I want to find out, say, paternity, maternity matters, DNA sampling and all that. how sure am I that my information is safe and secure with you, and that DCI or police will not walk in and demand that from you?
First, we sign a consent form, and there's a place for confidentiality. We assure you that we are not going to share that information with any other third party. And then apart from that, we don't deal with names when we're running the samples. We have like a lab case number, and it's delinked from the consent form. So when the sample is being analyzed or run in the lab, the only thing that is visible in the machine is just your lab case number. And the only way you'll be able to tell the source of that DNA profile or the name of the person is if you can go back to that consent form, which is not available. Yes.
Let's look at ethics. I think of movies that we've watched, for example, and so just like along the lines of what Dennis is asking, and then somehow your information gets leaked, or somebody intentionally, deliberately uses that information to be able to use that information against you for whatever reason. So this all then troddles into the area of dealing with ethics, medical ethics, research ethics. So to what ethics are research organizations bound by when it comes to the use of DNA of the samples? Because essentially, like you said, it's the makeup of who you are. It can be used in any way whatsoever. So how sure or guaranteed is anybody that the ethics that we hope one is bound by are carried throughout the process?
I would say it's more of professionalism, and then the respect of the privacy of the research participant.
Okay, so we sit on this side of the pond, but it's clear that the technology that is used here in Kenya is more or less the same technology that is used around the world. Let's talk a little bit about advancement of technology and what has actually been used and employed here that would meet the mark anywhere in the world. So how far have we been able to go in advancement of that technology to ensure that what you find is actually the right one?
I would say in terms of DNA testing, now we have moved from Sanger sequencing to next generation sequencing.
What was the first one?
Sanger sequencing. Yeah.
Okay.
So with Sanger sequencing, you would not be able to sequence the entire genome. Yeah. It would take so long. Yeah. For you to, for example, sequence the entire human genome. But now with NGS, you're able to sequence the entire genome and get a full picture of someone's genetic makeup.
Can I take you back, Dr. Aluvalaa? When you talk about sequencing the genome, I know you're saying it's just rolling off your tongue as though what does that mean?
Yeah.
It's sequencing the genome.
Yes.
Like getting the blueprint. Like all the entire genetic makeup.
Of what makes
everything that makes you and uniquely you.
Okay.
Yes. So with Sanger sequencing, you could only sequence portions at a time. Yeah. So you're not able to get the entire picture. But now with the NGS approaches, you can sequence the entire genome.
So that means with these NGS, I could just get into this machine and know this is what forms.
Well, I don't know. They're going to put the whole. Are they going to put the whole of Dennis in the machine, or what are we doing here?
No. Just a few cells. We don't need much. Yeah. It's very sensitive. Yes, but it gives a lot of data, a lot of information. Yeah.
With this information that we were just discussing in here, matters to do with the DNA has been considered to be something that is only necessary or used during investigation purposes. So let's break it down and make it appear as though it is a service that is being offered to anyone at any point. And at what point would someone just walk in and say, I want to know my DNA, I want you to take me through the Sanger sequencing so that I understand who I am and what DNA, what makes me me? Is that a case?
Yeah. It's not just legal. You could actually just come to KEMRI for a DNA test for personal knowledge. Yeah, which could be a paternity test. You could come to KEMRI. Yes. Sometimes we get cases of also missing persons, but it's not maybe the relatives are just working with the pathologist. They're unsure, and they just want us to test and confirm that missing person in the bog is theirs. So we still offer that as a service in the institute. Yeah.
Okay.
And as well, a matter of fine. I have received my results and everything. How do you sit down with the client to explain what it entails in them knowing their DNA references and all that, and how important it is? Because why would I come to KEMRI to have my DNA known?
So first of all, we explain that even before we do the DNA tests. You need to understand that there are only two outcomes. It could either be positive or negative.
There's
So you need to be
between.
So you need to be prepared. Yes, so explain the entire process, and that is part of the consenting process for the clients. Yeah.
Okay. We are talking with Dr. Eva Aluvalaa, and this morning we're looking at DNA testing, of course, then trying to understand how exactly this all works, what it can be used for, and what KEMRI is doing in the world of, groundbreaking research to ensure that across fields that you're able to make sure that the very makeup that you're looking for can actually be found. And we've been talking about DNA testing this morning, really trying to wrap our heads around, what happens with this in this field in which we are in. Now trying to understand what ways in which it can be used and how it can actually help with research. So do tell us about the work that KEMRI has been involved in as concerns DNA testing for Kenya. I mean, we know that people can walk in and get a paternity test, right? We know that maybe if, a crime lab wants to find out something, but what work has it specifically been involved in when it comes to Kenya and as KEMRI with DNA testing?
Okay, so I would say that would be research. So currently we are working on a genome resource for our population, and we've been able to get DNA samples that are representative of our ethnic diversity in Kenya. So African populations remain really understudied. The genomes of African populations have not been adequately studied. So this has brought in inequities in health, access to medications and treatments that are personalized. So we need to study our populations, because it's the European populations that have really been studied.
Right.
So the medications that have been developed are better suited for those populations. So we need to look at our genetic diversity and really get what is appropriate for our populations. So as a start in Kenya, we have started doing that. We have a pilot project right now in KEMRI that has about 1,000 samples that are representative of our population. And so far we've been able to work on the mitochondrial genome that cuts across in terms of forensics as well as in health applications.
That's very interesting, especially when you talk about the fact that, our African makeup, whether we're looking at the Negroid makeup, whether we're looking at, across whatever board, has not been studied. So by virtue of that non-study, then we're not able to make further scientific realizations about what you can do for treatment, about what you can do for even realizing what diseases affect us, what conditions affect us.
Yes.
So that then weighs heavily on the need for investment in research.
Exactly.
Doesn't it?
Yes. Because otherwise we'll be reliant on data that has been generated in a population that is not African or Kenyan. And it's not really applicable to us. Yes.
So does that mean that in the recent past, that's exactly what we've been doing to our detriment? That we've been relying on medication, for example. We've been relying on certain kinds of testing.
Yes.
That essentially is a far cry from who we are in terms of a makeup.
Exactly. In terms of even adverse reactions, how you respond to the drugs, for example. Yes. Yes, because they have not been studied in this population. We have not looked at our variations Yes.
Yeah, and you talk about DNA and healthcare, and with that you also bring about the subject of understanding who we are, what diseases affect us most, and how to be able to even produce medicine and drugs that are best suited for us. Now, with all this information that is out there and what KEMRI is doing, one would assume that the government is fully participating in this process and this progress, including other partners. So in terms of just the government taking center stage in making sure that we have this knowledge on who our people are, that we are investing as well in medication that would best suit our people. Is that the case? Is that the conversation you're having with the government?
We are still far from it, as I said. We're just at the pilot stage. Yes, and funding is actually an issue at the moment, yes.
Who's funding?
It's the government.
The government.
Yes, for the pilot phase. Yes.
Okay.
But it was just like, it's a small grant. And you're not able to sequence the entire genome. Yes.
Why?
And get the full picture. It's expensive. It's costly.
I'm sorry, I think the why is not in terms of why that can't be done, but the why is there no comprehension of how important this is. Because it took 2 seconds for me to see it. I can see how you would be able to, you need to make the connect between something as pertinent as health in the country or in the region or across the continent, that I can see it immediately, that I can understand that if you do research into these particular fields, a number of the issues that you deal with later on that are really expensive when it comes to healthcare can actually be taken care of. I can see that.
No.
So why do you think that then there is, it can't just be the expense alone? Is there an understanding, a comprehension that if you nip it in the bud at the very beginning, you save yourself the burden and the expense later down the road, I would assume.
Yes. I think maybe there's more need to have advocacy, awareness, create awareness, more awareness. Maybe there's a disconnect between the scientists, the public, and probably the government as well. Maybe we need that more advocacy. Talk about genetic testing and how important it would be. Yes.
I think my next question would be just follow up on what Ndu asked now. Here's a question where us as a people, we do not have our information that would go into further research into the medicine and drugs that we consume, which then brings me to the fact that that means that all through the medication that we've been using is meant for other people. So in terms of, I mean...
I'm sorry.
Not really. But if you study your population, it will become more precise.
Okay.
Much better. The treatment outcomes would be much better.
Much better.
Yes. Especially if there's a genetic aspect to it. Yes. Not all treatments have a genetic aspect to it. But those that have, then you need to study your own genetic variations so that the treatment can be personalized or individualized.
Right.
Yes. And this is particularly more important in non-communicable diseases like cancers and all, yes, but not a common flu, perhaps, for example. Yeah.
So understanding the financial restraints, for sure, what strides have been made? How far have you actually gone? I would assume that right now KEMRI is the research organization in Kenya that's dealing with this genome testing. Genome testing specifically, for the diseases and all, the makeup, essentially. How far have you gone? And where are we right now to say that, okay, at least we know 1, 2, 3? How far has that gone?
So apart from having this pilot genome resource, we have also started a society, the Human Genetics and Genomics Society of Kenya, that seeks to bring together all health professionals who are interested in human genetics research, such that it's not just the researchers in KEMRI who are involved, but we want to bring in medics who actually deal with the patients. Because what we have right now is just data from the general population. We do not have samples from, for example, disease cohorts, like maybe cancer patients. We just have samples that we collected from consenting participants from the general population. For this resource to be useful, you need to also incorporate disease cohorts. So you want to bring in as well genetic counselors, because it's really important. You can imagine if you have a disease or a mutation that runs in your family, you need to know, for example, sickle cell.
Yeah.
People need to be aware, but you need another level of a professional to discuss this with you so that you understand, like genetic counselors. So you want genetic counselors, you want pharmacists, all those people to come together. And then perhaps you can be able to do like bigger grants, attract bigger funding. Then you'll be able to do this kind of research.
All right. Doc,
because you cannot operate in silos.
Okay, sorry.
The research scientists cannot just work alone without the doctor, the genetic counselor.
Okay.
Yes, we all need to work together for this to be effective.
Right.
Yeah.
Now, Doc, there are a lot of questions that our people are asking here. Let me just go through what they're asking now. Chris Maura, why is DNA test expensive in Kenya? The same test is a fraction of what Kenyan hospitals charge. It is the same question that is being asked by Samuel and all that. I mean, there is a feeling that access to DNA information and testing is expensive. So let me just ask, how much is it if I would walk into an institution and I want this done? How much is it?
We've been charging 20,000 for the last 10 years. We've just recently adjusted it to 27,000 Kenya shillings. And this is not a test for just one person, it's 3 individuals.
Okay.
So I would say it is pretty affordable. Yes.
Affordability
It is
on that.
affordable.
It is.
Okay.
Yes.
Yeah.
I imagine that this kind of genome testing, the DNA testing that we're talking about, that on that side, but I would imagine that genome testing would be a game changer, especially for African countries. And I'm going to say that African countries who, let's look at COVID, for example. When COVID came about, the social part of that whole disease and argument was that African countries or populations are going to be wiped out by COVID. And then everybody started doing what the West said to do, because that was true.
Yeah.
Wash your hands as though we never washed our hands before. Don't talk to each other and wear masks as though, you don't live in communities. And gather herd immunity, etc., etc. But I would imagine that if already you had a blueprint of what your genomes look like, even if you were able to extrapolate that to communities by virtue of doing some testing on certain subjects, that from the get-go you would have been able to know, actually, you know what? Here's the makeup of the disease as COVID. Here is the sequencing of, the majority of African populations. And we will then be able to see that, first of all, no, it's not going to wipe out African populations. Number 2, our makeup would then not allow this disease to wipe us out, because for golly's sake, we're dealing with things like malaria that's not wiped us out yet. We're dealing with other things that may have wiped us out, but it didn't. So it would have helped us in certain things. And so we bring in the arguments of, then maybe people didn't need to go about taking these vaccines all over the place and running about and then getting all these, because those are, is there a myth in all of that? Or would we then be able to know from the get-go because of this kind of research, and you bank that information and so that when something comes in the future, you actually be able to say, hang on, Big Pharma, we don't need this vaccine because we know that we have this, and the research has already been done by folks like KEMRI, and we know that actually this kind of disease, with our makeup and the sequencing that we've been able to do, we know that this will not affect us. Carry on, Big Pharma, in this part of the world. We're dealing with these other things that we have to deal with. It sounds like a very simplistic argument, but does it make sense?
Yes, it does, but you need the resources. So yes, we need the money,
This is
the
what I'm saying.
resources,
This is
the
what I'm saying.
funding
An argument
to
can
be
be
able to
made
do, yes,
for it.
yes.
An argument can be
So
made
that-
for it, yeah.
Yes.
Because in the event that world things like COVID happened, where we look and we say, okay, wait a minute, over the last 3 years, what just happened? They shut down the world. Maybe we didn't need to shut down Africa, for example.
True.
Is that not where something like that would then be able to help?
Exactly, to help in that aspect, yes. Yeah.
And as well as just the fact that in the African population, let me take Kenya for example, the fact that once a child is born, there are these vaccines that are actually issued, BCG and all that. And having a blueprint with all these other vaccines that we already have, would that then go into also just creating a case on things like, say, the vaccine that we have, BCG, would have effect to COVID in such a way or the other? But the fact that I'm just assuming. I'm not a doctor. I'm just assuming. I'm trying to plead the case. And the fact that we don't have that information, it is therefore denying us an opportunity to see what to avoid and what to take.
Yeah, I would say before we uptake anything in terms of diagnostics, vaccines, and treatments, it's important for them to be tested in our populations first, irrespective.
COVID vaccine, was it tested? Did you take that test for COVID before it was actually administered to Kenyans?
I'm not sure how the extent to which it was tested in our populations, But before it is mass administered, it's important that clinical trials are done in the population. Yes,
Okay. What would the future, and future could be tomorrow, future could be 6 months from now, but what does it look like in then being able to, really harness the results of this research and what it would actually be able to do for our populations?
It takes time. I would say such a project, a genome project, cannot take less than 5 to 10 years. Yes, so we need to start immediately, as soon as possible.
And what are the dangers of not? Oftentimes we look and we say, okay, this would be great if we can do this. We can. What are the dangers of not?
We miss out on the benefits of genome research. Precision medicine. Yes, you're exposing our population to possible adverse effects. Inappropriate treatments and all.
When you talk about precision medicine, just paint a picture of what that means. So say take a certain disease and precision medicine. What does that mean?
I'll probably give an example of reaction to a drug. You have like 3 categories. Like there are people who are quick metabolizers, intermediate, and now the ones who are really optimum. So you cannot just say a certain dose would work for everyone, like a blanket dose. But depending on your genetic variation, then you can determine whether someone is an intermediate, a quick, or the optimal metabolizer. So if you give someone who is a quick metabolizer a dose for a low dose, then it's like you are underdosing them. But someone who is what is the opposite now? Someone who is a slow metabolizer, and then you give them like a high dose, it's like an overdose. So the treatment outcome is not the same.
How would you know who was quick, slow?
You characterize their drug metabolizing enzymes, so that you know this person is a quick metabolizer or not.
Okay.
Yes.
At what level, at what stage would you do that though? Because we're talking about medication, essentially, or vaccine or whatever. At what stage would you do that to be able to know, okay, this person is, what part of the conversation would this come in?
I don't think in Kenya we have reached that level. I'm not a medic, I don't work in the hospital, but those tests can be done before treatment is administered. Just the same way we would go for like a stool test, a malaria test. Yes. Or even prior, if you're able to get like your genome sequence or some of those sequence prior, then the doctors can have your medical records. Yes.
So I'm assuming this is pretty important information even for me personally, in such that I come to KEMRI, I go through all the sequencing and I get this data that I need, so that the next time I go for my education, I can present this to my doctor and tell them I am a fast metabolizer or slow metabolizer, and this would be the proper prescription of drugs that would work best for me. That is information that say I need for me to get the best results from treatment.
Yes. But I think the best approach would be not on a research side. These tests need to be integrated in hospitals. Because you can imagine trying to present results to your doctor and telling them and trying to guide them. I believe that information needs to be part of your medical records in hospital.
Yeah, that's interesting as you say that, though. Part of your medical records in hospital. But when we look at disease prevention, there is the whole aspect of, 100% prevention. And I'll share that we have heard of famous cases where something like breast cancer, that is one of the hereditary cancers, right? And that having taken this DNA test and compared with women in your lineage, that you're probably next in line to develop breast cancer just because of the lineage, hereditary lineage. So you go in, we heard cases of this, you go in and have, and it could even be ovarian cancer. And because of the results of that DNA testing and the linkages that have been made, you go in and have, a hysterectomy for ovarian cancer, or you go in and have, what is the one for breast cancer? Mastectomy. Right. You go in and have a mastectomy. So we're looking at ways in which this particular DNA testing can help you with 100% prevention of a cancer, for example.
Yes.
Is this one of the ways in which we're seeing this can work when you talk about having these tests then available at hospital when you go in for prevention screening, for example?
Exactly. Yes. It can prevent. And this would also apply, for example, in sickle cell cases, because you could be a carrier as well of the disease. Maybe you want to get married and you're in a population where many people are carriers. So there's a high chance that you might also marry someone who is a carrier. But if you do the screening, then you'll be aware. And if your partner also does the screening, then you will be aware if they are carrier of the disease as well. You could still have children, but maybe you are more aware, or you could avoid having kids. Yes.
That's interesting because I do know that in parts of Nigeria where the sickle cell burden is very high, that particular DNA testing is carried out, and it's actually put on of course, with the confidentiality, it's put on your form, not to prohibit you from entering into this relationship, but for making you aware of, the possible outcomes if you were to then, have children with this other person in terms of what could happen if you were a carrier, if you were not,
Yeah, because if you're a carrier, you're not sick. But if your partner is not a carrier, then you'll have healthy children. Some could be carriers and some are not. Yes. Yeah.
And I look at a situation where with all this information that you have brings then the government and the need to have all this information, or the need to have these be backed by a certain policy in this field, such that if I go for, say, a medical checkup, perhaps there is a way that I'm protected by the law that this information is in my medical file, so that at any point I go to a hospital anywhere in this country, there is a database that a doctor would just get into and access this information, and I get treated. Would that be the correct way to go? I don't know.
Yeah, I believe so, but we are a long way from that. Yes,
What would your hope be? And I ask this question when we look at implementation, whether it's at a government policy level or whether it's at a research policy level. What would your hope be of implementation of some of these things in the next 1 year? What would you want to see? You talk about research, 1 year may be very short. In the next 5-10 years, where would you hope to see that this DNA testing, for example, has taken even Kenya, looking at regions? Where would you hope it would go in that period of time?
I hope that it can be integrated into medical care, yes, so that we don't look at it as just research level. Only the patients who are recruited into research studies, but even patients who go to hospitals are able to access these tests. For the doctors to now be informed of the most appropriate treatments to administer to their patients.
And then really lastly, what would it take because I think when we talk about medical care, when we talk about research, one of the big issues is cost. What would it take to reduce some of these costs?
Yes.
I mean, what was the price of a DNA test you said again?
27,000
shillings. My goodness. You know, for a lot of people, for healthcare seeking behavior, that is a fortune. You know, but here we are also saying that there's certain things that you can avoid if you had the sequence, if you knew. What would it take to reduce some of these costs?
I think if we have like reference laboratories, it would really help, because most of the times the costs are high because you're trying to test one sample. But if you're able to batch them up and run many samples at the same time, then the prices automatically come down. So instead of having small laboratories trying to do this testing all over the place, it would be nice to have a national genome center, a national genome lab or something, where all the samples that require genetic testing can be sent to. It becomes cost effective.
Yes.
And also the turnaround time
Much faster.
reduces. Yeah.
Indeed. Dr. Eva Aluvalaa, thank you very much for being here this morning. I mean, really interesting and being able to understand how some of these things work. Dr. Aluvalaa is the head of Human DNA and Forensic Lab, KEMRI. Thank you very much for being here this morning. Good morning.
This is the Situation Room, the only way to start your day.